I think we have to realize that the Bologna criteria are more or less a mathematical model to define a population, and it does not come up with any clinical recommendations whatsoever. Moreover, the Bologna criteria actually did not take the age-related effect on the oocyte quality into consideration. With the Poseidon, we do two things. We substratify patients into 4 groups, because the problem with the Bologna criteria patients was that this was a very heterogeneous group, although the intention was to create a homogeneous group, but at the end we can all see that this was a very heterogeneous group. Now we are subdividing patients as to increase the homogeneity of each group, so we now have 4 groups. This is one thing. The other thing is that we come up with clinical recommendations as how to treat these patients. And finally, the optimal goal for Poseidon will be to propose a calculator, and we are working on this issue as to how many oocytes do I need for this specific patient to be able to transfer 1 euploid blastocyst. I mean, this is a $10,000 question that your patient will ask you and which you also ask yourself. So these are the main points of Poseidon. I am quite sure, and this is also the feedback we get from the audience when we started presenting this idea, this is going to be maybe not a revolution, but a clinical revolution somehow, because for the clinician this will really give him a much better aim, and he will not be just working in the darkness. He will know how I need, for this specific patient, I will need so and so many oocytes. This is extremely important, because this will change his policy. Maybe in some patients, to achieve this number of oocytes, you need to do repeated retrievals, like dual-stim, for instance, to bank oocytes or bank embryos. Maybe you need to do 2 dual-stim rounds before you end up with, let's say, the amount of oocytes needed for one euploid blastocyst or embryo. So for the clinician, this is of real significance. For the patient, because we plan that this database should be open for the patient also, maybe not with all the information that the clinician will provide, but a simpler database or simpler calculator telling the patient how many oocytes she needs. And I can tell you already now, when I counsel patient, and you have a patient who's 41 years old, and she comes for her first IVF attempt, and you can see that she has got a total of 4 antral follicles, and you tell her, 41 years old, we need 18 oocytes to retrieve or to be able to transfer 1 good blastocyst. This sets everything into perspective for the patient. And these patients will either choose to stop, which very few will do, but when they then embark on treatment, they will not accuse anyone else about the results. They know what they start, and they know that they are working against something very tough, biology. I think there will be no more large trials in Bologna criteria patients, because the SBAR trial is the largest, and it was a very costly and a tedious trial. So this will probably be, let's say, the last trial. But what we need now, we need trials in the looking into the Poseidon stratification, seeing that patients who are randomized to the different treatment protocols that we suggest for the different degrees of Poseidon, that they actually work. So we need to prove this in the prospective trials. So this would then mean that we already decided that we're going to leave the Bologna criteria and move into Poseidon, because Poseidon also embraces Bologna patients. But we need trials showing that what we suggested actually holds for true and benefits the patient.